Hello and welcome. I'm Mabel Jong, and you're watching WHCC TV, where we're streaming live content from the World Healthcare Congress, coming to you from Washington, D.C. Thanks for joining us. And the healthcare market space is changing so rapidly. Where are the emerging trends? We're going to ask Jessica Brooks. She's CEO and Executive Director of Pittsburgh Business Group on Health. Thank you so much for joining us, Jessica.
Thank you for having me. I'm excited to be here.
Now, I talked about emerging trends. Are you seeing that with your members that are part of your group?
I am. It's interesting. So the Pittsburgh Business Group on Health, we have over 100 members representing 2 million lives across the country, across those members, and over $5.5 billion in spend. So you can imagine it's very diverse. We have public employers, private employers, education institutions, government. So it's where they are on the journey of emerging trends is very different. But what is exciting to see is not your typical players are stepping up and looking to transform healthcare. A lot of the mid-sized companies are making pretty interesting moves when it comes to their plan design decisions, as well as looking on how they can connect to the provider community through either direct contracting arrangements or innovative TPA strategies through their vendor management processes. So it's exciting to see that not initially when we started, large employers were really taking the lead, and now you're seeing both large and mid-sized companies stepping up in a different way in how to navigate healthcare costs.
Well, how innovative are you seeing some of these health plan designs now?
Yeah, so the health plan designs are, so up until maybe this year, we saw a continuous increase in high deductible health plans and cost shifting strategies versus truly managing healthcare. And we're starting to see employers realizing that although their industry might not be in the healthcare industry, they're in the healthcare business, whether they want to be or not. And now they're choosing to intentionally own that through different strategies. So we're looking at employers who are considering centers of excellence strategies. We're looking at employers who are interested in direct contracting in a very highly consolidated marketplace where 90% of our physicians are employed versus independent, but they're still looking to see what they can do to navigate and partner with providers who are willing and who are aligned with their values around quality outcomes.
Well, expand on that centers of excellence. How is that being defined and who's driving that?
So we're following a lot of different employers and coalitions like the Pacific Business Group on Health and the Western Coast, who has taken a lead on that for several years. And so we have employers now looking at some similar models that Walmart has adopted around those centers of excellence. So I'm not seeing our employers redefining the wheel. They're looking at employers who have trailblazed already and identifying and who have defined centers of excellence, and then aligning that with their most costly areas for their organization, where they're seeing their utilization increasing or having a high impact on their bottom line. They're identifying those and then targeting those centers of excellence. So it's Cleveland Clinic, for example. We're in Pittsburgh, so that makes sense for employers to partner with Cleveland, which is only a couple of hours away. Employers are still very sensitive around how far they send their employees and who they partner with to make sure that it's accessible, not just affordable, but they're able to get there, they're comfortable getting there. So they're looking at what's in our surrounding areas and who's performing well, and then are willing to consider further centers of excellence that may be out of the geographical footprint of where their employees rely.
Okay, Jessica Brooks, it's such a pleasure to speak with you today.
Thank you, I appreciate it.
Thank you for your time.
Thank you.
And I've been speaking with Jessica Brooks. She's CEO and Executive Director of the Pittsburgh Business Group on Health. There's much more content on the way, so stay with us. I'm Mabel Jong.